Hello, 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 and welcome, welcome, welcome. We are so glad that you're here. Sincerely overjoyed that you're here. I am Tansy, and this should be streaming on LinkedIn, Facebook, and YouTube. So wherever you're dialing in from, thank you. Thank you for making space for us. Thank you for being here. If at any point you have any issues, you can type it into your chat on whichever platform, and we will try our best to fix it. We are not tech gurus, so there may be issues. So if something disconnects or goes offline, please join us on one of the other two platforms. So again, your choices are YouTube, Facebook, or LinkedIn. Just look for We Are 1M4, and we'll be right there. So again, welcome. Good to see you. My name is Tansy McNulty. I'm the founder of 1 Million Madly Motivated Moms, 1M4 for short, and we are overjoyed that you're joining us today for this Gen Z conversation about mental health. So any of our events, they start the same way. We take a few minutes to relax our shoulders, take a few cleansing breaths, and just be present in the moment. If you need to grab some tea or some water, whatever you need, do just that. And know that this is a safer space. I can't call it a safe space. It's still the internet, right? But we make it a point to make this as safe as possible. So you can ask any question you want to. Our panelists, we have communicated that there's nothing off limits. There's no dumb question or any silly question. Feel free to ask it. We will try our best to get to most of the questions during the conversation by weaving that into some of our predetermined questions. We really want to hear from you. We want this to be conversational. We want you to feel comfortable. We want you to feel loved. I know you're like, what do you mean you want me to feel loved? You never met me. I have not met you. But know that everyone on this call, every panelist, every face you see right now loves you, whether we met you or not. And we're here to make sure that you get the information that you need, that you feel seen, heard, understood, and that we're giving you the resources that you need to thrive. So that's why we're here. So take a couple breaths, ground your feet, lay back, whatever you need to do to just be present in the moment. If you want to, you can let us know in the comments where you're dialing in from. We'll be able to see you. I'm in Northern Virginia. We have some people on the West Coast on the call. We have some that are in the Midwest. So we're glad that you're here. Who are we? So we are the women of 1 Million Madly Motivated Moms, 1M4, and we are a coalition of Black maternal figures and allies working to end police violence in this country by the year 2038. We know it is ambitious. We are aware. When people hear that, they're like, what are you doing? We're doing all that we can to keep you safe. So we're in this space because it's important for us that mental health emergencies or people that are showing symptoms of mental illness, that they get a mental health care response. And research has shown that Gen Z, that usually if there's a mental illness or a mental health challenge, it shows itself in the late teens and early 20s. And so that's right there where Gen Z is. We want to make sure you have the tools to know what's happening to your inside your body or what you're feeling, and you have the language to communicate it, as well as to be able to work with your loved one, your caretaker, your parent, your godmommy, your auntie, whoever is caring for you, so we can work together in this. You see these faces on here because we kind of represent different portions of people who care about Gen Z. We have Aubrey, who you'll meet shortly, who is a Gen Z member. We have Ton here, who's a mother of Gen Z. And then we have Dr. Dion here, who is, you will hear all about her in just a moment. Just a moment. She is well skilled, well versed in this space. So again, we are welcoming you. I am going to turn it over to Aubrey to introduce herself and to share a little bit about her. Go ahead, Aubrey.
Hello, everyone. As she said, my name is Aubrey, and I am part of Gen Z. Currently 18, going to be 19 in October. And a little bit about me: I go to Morgan State University, upcoming sophomore, majoring in psychology. It's my hope in the future that my career path is a therapist, primarily working with children. But my overall long-term goal is having my own practice that is Black-led, for Black people, by Black people, because there's a lot of stigma in the Black community surrounding mental health, and I just want to destigmatize that and help us out a little bit more. I'm also an intern at YMG Youth Cast Media Group, and basically what we do is we work with teenagers, students from minority, underrepresented communities, and we talk about public health, mental health, health disparities, decriminalizing mental illness, food droughts or food deserts, safe driving. We talk about it all. So if you want to check us out on Instagram or TikTok, we're at Youthcast Media Group. But yeah, that's all about me.
Good deal. Go ahead, Tom.
Hello, everybody. Tansy, thanks again for having me on today to just kind of be able to be in the space with you all. And yeah, my name's Tan Hall, and I'm the mother of Miles Hall, who unfortunately was shot and killed in 2019 by Walnut Creek Police Department while experiencing a mental health emergency. I've dedicated my work, my life to our foundation, the Miles Hall Foundation. Our goals are to remove police from mental health calls when they don't need to be there. Also to protect those most impacted by mental illness, and also making sure that excessive force by police isn't happening. So I'm glad to be in this conversation. I do, obviously, my son, yeah. Anyway, it's tough to be here, but I'm excited to just be able to contribute to this conversation. So thank you.
And Dr. Dion.
Hi, I am Dr. Dion Hard. I am a psychiatrist and addiction medicine specialist. I am in Rochester, Minnesota, adjunct staff at Mayo Clinic, primarily work for Department of Justice. I identify as a physician advocate, currently on multiple organization leadership boards and roles. Most recently joined the Board of Trustees of the American Psychiatric Association. Very happy to be in this space to remind people that living with a severe mental illness is not a crime, that you are not alone, and that there are people who, as Hansi said, care about you, love you, and want to assist you and make sure that you recover and that you live your healthiest life. So thank you for the opportunity to be here.
Thank you all for being here. As you can hear and see, we represent just different parts of this mental health journey. We sit in different seats. I care about this because I do have, 2 children. They're very young now, but they will be in this age group before I know it. And so and I want to reiterate too, I'm not sure if I shared this before, but if you registered for the event, you don't have to worry about taking notes or grabbing links or anything. Everything we mentioned here will be emailing to you after this recording. You'll get it likely tomorrow afternoon, which will have every link, every hashtag, every social media handle. We got you covered. We want you to just be able to focus on the conversation, ask the questions that you have, and just really be present. All righty. So we are going to jump right in. So I want us to, we have all these panels and webinars and all these conversations in different spaces, especially over the last 4 years, right, since the pandemic. But people usually just jump in without defining what we're talking about. And it's very important that you know that we're all working from the same set of definitions. So we're talking about the same things. And so I want us to level set on, I'm going to direct this one to Dr. Dion because of her expertise first. But help us define, what is mental illness versus what's just mental health. And then some of the definitions on the different types of caregivers or service providers. That's your psychiatrist. How does that differ from a psychologist? And then a therapist from a counselor. And then touch on the difference between destigmatization, because I know you all heard Aubrey say destigmatizing mental health. Then she also said to decriminalize mental illness. Like, what's the difference in stigmatizing and criminalizing? So I'm going to shoot it over to Dr. Dion, and the rest of us can jump in as needed. But I want us to really get clear on just different terms, because this stuff can be confusing sometimes, particularly for younger people. And honestly, for some older people too, let's be real. I've seen some posts, and they are not accurate. So let's just level set on some definitions. We'll start with Dr. Dion.
Okay, so I'll try to cover all of those bases. So I mentioned that I'm a psychiatrist, so I'm a medical doctor. I went to medical school and then specialized in psychiatry, which is a specialty of medicine. We learn about brain disorders. Mental health is health. So oftentimes people forget that psychiatrists are physicians, but that is what we do. From the start, we are physicians, so we're not only concerned about your brain health, but your complete body. So, psychologists, who we closely work with and are often confused with, are PhDs. So they go to college and then graduate school. So they may do research, they may do more of a clinical framework where they're doing therapy with patients, but I know there are some states that do, but they are not trained in medicine, so they do not prescribe medications. I know some states allow that, but in general, that's just not true. But there's counselors, there's therapists, there's some licensed social workers who also do therapy. There are people who identify just as a mental health professional and may have a role. There are also peer specialists, so people with lived experiences who support people living with mental health disorders. Um, Mental health is health. So, how you can't separate your organs out and just say, oh, well, my brain is not healthy, so that's fine. The rest of my body is good, and say I'm a healthy person. No, every part of your body, every part of your being, um, it's important. So we don't separate the two. And I know that there has been a problem, especially in the Black community, where people just try to pray away mental health problems, but then they'll go to a physician and discuss other parts of their um, body, like physical health, mainly like hypertension or diabetes, things like that. Well, they'll prioritize that, but not their mental health. Um, so unfortunately, in our community, the way emergency services have been um, set up is that you dial 911 and the police come. And police are not trained in general in addressing people who are living with a crisis. So, to me, what's most dangerous is you introduce someone who has limited training and with a gun into a situation where somebody, if they have heightened emotions or they have problems with they're confused or disorganized, or maybe they have competing stimulation, they can't follow directions very well. So you have somebody like sometimes in a very loud voice giving them rapid commands, and that often goes wrong, especially in our community. Um, and that we have a panelist who has lived experience with police not responding appropriately. And so it can be very dangerous. We talk a lot in the last few years about Black Lives Matter and how just showing up as a person of color puts you at high risk for a negative outcome. But that's even more so if you are a person living with a mental health disorder. And a person on top of that, with a person of color living with a mental health disorder is very dangerous. So we have a lot of advocates, including Ton, who are making sure that it is safer to get help in a crisis. So that's why we talk about destigmatizing, so making sure people feel safe getting help for a brain disorder, but also that when you have a health problem, it doesn't lead to you being introduced into the criminal justice system, because there's no other health problem that I can think of where somebody gets arrested just because they're symptomatic, or somebody loses their housing because the paramedics or emergency services come too often. So we just have to make sure that we as a community value all of health, and that we take out any type of negative impact on somebody reaching out and receiving help. So I hope I answered all of those questions.
You did. You did an amazing job, Dr. Dion. Thank you for that. And I'm so glad that you clarified specifically the difference in stigmatization and then the criminalization. It's the comfort and knowing that it's okay to have a health concern, right? Let's destigmatize it, but also let's not criminalize it. Let's not introduce people to a carceral system or state-sanctioned violence when they are in need of a care-centered, health-centered response. And 1 in 4 as an organization, we put together a directory. This year, one of the first resources will drop out to you, therightresponse.co. And Ebony will drop that link in the chat for you. You also have it in the follow-up materials. That no matter where you are in the nation, right? We have over 250 response organizations, mental health response center organizations across the nation that can respond to you in your time of need. Most are community response teams, meaning that's someone from the community, a clinician, a medic, a peer who can respond to you. And then there are some that are co-response teams. And that means there's a police officer there, but that person is coming with a clinician. And the clinician should be centered in an interaction. And that's to hopefully, this directory is to hopefully reduce the likelihood of other parents going through what Ton and her family have gone through. We want to drive that to zero as much as possible and as quickly as we can. So we wanted to make sure that we talked about the differences in these terms. And I'm so glad Dr. Leon also called out that health is health. You cannot take your mind out of the rest of your body, right? Mm-hmm. Right. If it's happening to you, it's happening to you. And it is just simply your health. Aubrey, I want to cue you in. Anything you want to share from your expertise in the communication, the research that you've done on mental illness or even on mental health and the differences in the two, or even on the criminalization side?
Yeah, I can speak a little bit about it. Not too much because I know I just finished my first year, but it's very common for people to go undiagnosed, right? And I feel like that's also a really big deal when you go undiagnosed. I feel like, and I wouldn't say like don't quote me on this, but like if you go undiagnosed, I feel like you're more likely to be criminalized with a mental illness, you know what I mean? Because they might think, oh, you have a behavioral problem, you're just a bad kid. No, like this child might have ADHD, this child might actually have something going on with them, and it's not something that they or their family realizes. I think that needs to be brought up and raised awareness to. Mental health, I know, like, I think this is like a question later on, but Gen Z does take mental health pretty seriously, or we're starting to take it a lot more seriously, creating boundaries for ourselves and for others, catering to ourselves, loving on ourselves more, and showing that to other people, holding ourselves accountable. But yeah, that's really all I have to say about that.
I love that. Thank you. I want to come back to your the question about how Gen Z shows up online and how they set these boundaries and how they communicate that. I want to call Tom in to share about how the pain that she has gone through, how it has led to now revolutionary solutions for other people in that area, specifically about A3. And A3 is, I'll let her tell you about that. They're on our Right Response directory as well out in California. Go ahead, Tom.
Yeah, no, I mean, I think, knowledge is power, right? Knowledge is power. Knowing what is out there, what resources are available. Unfortunately, with our family, we had so many roadblocks. It's a very, very reactive system. It's not preventative. So that's where the work that the Miles Hall Foundation and the legacy of Miles comes into the work, is because we want to make sure that there's proactive measures, which yours, the Right Response Directory, is a perfect example of that, right? So if I had have seen something like that, it could have been helpful, right? For me, we just really want to make sure that people understand what's out there. So as you mentioned, in our county, I live in California. I live in Northern California in Contra Costa County. And with the aftermath of my son's death, we really pushed for change in legislation and change in local government. And we were able to there's something called A3. It's someone to call, someone to come, and somewhere to go. And that's like a kind of a wraparound service for someone in a mental health episode. And then, so now that directory is that number is in your directory. So the good thing is that since you guys have created this, it's something, it's an option for other people throughout the nation, which is so amazing and so helpful. But also with Miles's death, there's also in our California, we have what we call AB 988, and that's called Assembly Bill 988. And then that means that all counties within California now have to have a mobile crisis unit. So as we talk about mobile crisis, as we talk about having the right resources, it is happening, right? It is happening. But the thing is, we want to make sure that it doesn't take more deaths like Miles. So again, it's that preventative measure, the preventative, what you're doing, the work you're doing, Tansy, is, so important. So I really appreciate the work that you guys are doing. And then as Dr. Hart said, the criminalization, like we should never have to use police for like the first responder. And that right now it's that way for most states, that police are still expected to be the first responder. So taking that out, taking someone who doesn't have a gun, who's coming and bringing them in and with someone who's trained is going to be life-saving, right? So it's so great that you have this directory for people to see, to people to use. I know we're, definitely promoting it on our website because it's just a resource. And that's the thing, is people need resources to know what can they do? Because sometimes you really are stuck trying to find those help, because it's, like I said, it's very reactive.
I agree. I'm interested in, well, first I want to say to those who are watching, you can help us with this. You are the trusted voice in your community. So by you learning about these resources, learning about the right response, learning about 8-3, learning about 988, learning about all these things that you can go to, and you tell your cousin, you tell your classmate, you share on social media, like your voice matters, because people they don't know Tansy, they don't know Aubrey, they don't know Spawn, they don't know Dr. Dion, but they know you and they trust you and they will listen to you. And you can and should be a resource right there in your local community, right? So once you get these resources after the event, as you're looking at the links that Ebony is dropping in the chat for you, please save them, make note of them, look around, let us know how we can improve them. I am all about improvement. Please criticize my work and help us be better, because we want to make it more useful for you. And speaking about, sharing your knowledge, sharing your resource, I want to go back to Aubrey to share so Gen Z is very vocal. They can be very vocal about what they think, what their boundaries are, how they're feeling. Like, how do you all, for Aubrey specifically, how do you see, using social media as more of a useful tool and not one that drains you or is, increasing your negative outcomes, the one that you can use to truly be proactive? How are you all using your voice in this space, particularly what you do with Youthcast Media Group and in your own, personal life?
Well, first I'd like to say that I know a lot of older people and older generations think that, oh, we're lazy, we don't do anything, we don't want to work. But Gen Z, we take a lot of notice about the things around us. Gen Z is very passionate about things going on in Sudan, Palestine, Congo, and we help each other out. We give the facts about, and I'll use this as an example, Palestine. We give the facts about what's going on in Palestine. We sometimes people have GoFundMes for family members, and we really just hold each other accountable. And that way we use social media to do it quickly and to spread it very fast. And that's what I mean, quickly. We spread things very fast with the information that we receive. We debunk a lot of myths and false facts and whatnot. And I feel like in that way, social media is such a tool and such a help. It can damage a lot of things, but it can also help so much because we have that access to the entire world. You know what I mean? We can talk to each other in an instant, and there's translations, there's the internet. We have so much access to everything, and it's such a great tool. And I love it personally.
That was one of the questions that came to mind. I know we had something in here about social media and how you would, having access to being, truly being a global citizen, having access to the world at your fingertips. what strategies or tips would you have for your peers who it may seem kind of like a lot when you mentioned Congo, Palestine, so that like all these things are happening, and then you have like I don't know finals, like have other things going on in your life. I got to pay the rent. Like, how are you managing, and what techniques are you using to protect your mental wellness? While yes, you want to advocate, yes, you want to hold people accountable, even yourself accountable. Like, but how are you also, protecting yourself, protecting your health, and how can you? What tips do you have for others, and things that have worked for you?
Personally, me, I'll give a couple, to be honest. And this goes for anyone, like, no matter how old you are, find a hobby. That's so important. Find something to do. Go take a walk outside. Start gardening. Plant a garden. I personally write poetry and I crochet. And so, in that way, I just like crocheting, especially, I keep my hands busy. I have to count certain things, and it takes my mind elsewhere from whether it's um, like I don't get bullied anymore, but if I was to be bullied, it takes my mind off of that. It takes my mind off the real world. It takes my mind off of class and studies, and that really just puts me in the zone. Another thing, have a strong village or have a strong support system, whether that be your best friend, your mom, your teacher, your grandma, whoever that may be. Find a good group of people that you trust and can go to whenever you're in need and need somebody to talk to, calm you down. That's gonna make all the difference in the world. Creating your own village. One more thing, coping skills. Like I said, I do poetry, I cook, I do art. I don't know if you see my wall over here. I do art. Um, I crochet. But finding coping skills and creating your own, because not all coping skills work for everyone in the same way, but creating your own coping skills and finding the ones that work for you also help. So yeah, those are 3 tips.
I love that. I love that. I'll ask my other Dr. Dion and Ton. Any other from our generations?
I think I'm Generation X. So,
I'm a
but
Gen X, so I'm an old millennial.
yeah, I'm a nana, so I have a, a Gen Z grandchild. But I will say, like, we talked about tools, like Aubrey said, it's a tool. Social media is a tool. So, like any tool, you need to learn how to use it correctly, because if you don't, you can hurt yourself or other people if you don't use it correctly. So, I know, like when I was like in that age bracket, I was bullied. I was a small person. I'd rather like read a book than like interact with people. Like I was target. So I can imagine like after school though, you came home and you were in like your safe space. But with social media, you bring those spaces into your home and you don't always turn it off. So like I would say number one, have like your time when you turn off social media, whether that means like you set an alarm, you have like a cue, whether it's like dinner time, something, but do not live in that space all the time. I love the idea of like having a hobby and like something that you do with your hands to stay active. But I think the most important thing is to realize that although social media can be detrimental, have some harms, it is an amazing tool. Like you said, you're connected to the world. You know what is happening in other spaces. You can advocate for people who are suffering in any part of the world. But there are also like tools. Like if you are not somebody who feels comfortable talking about your problems in a physical space, you can have virtual conversations with people. You can have anonymous conversations with people who share some of your issues, and you can have conversations with people who can connect you to the right treatment. Um, so it can be a very useful, very effective tool. It is amazing the amount of like information you can get. You just have to make sure you use it correctly. And depending on your age, like if you're a young Gen Zer, make sure that your parents are aware of like how you're using social media. And I know nobody likes to have like supervision, but using, I would say if a parent or a grandparent is listening, make sure that you know about the tools that can help you keep your child safe. Because there are people, again, who use the internet inappropriately. So you want to be able to like guide them through to make sure they're not overwhelmed and make sure they're safe, because it can be such a useful tool if it's used appropriately.
Yeah, and I would also just chime in, and as far as when Aubrey was talking about hobbies, and that was definitely my son. Miles was all about like making his own beats and rapping, and like super journaling, and the journaling became a rap, right? So I feel like it's an outlet, and finding those outlets that are gonna like kind of just de-stress you and calm you down, or just get your mind off other things that are happening. Because as Dr. Hart said, I mean, it's a great tool, but it's also could be very detrimental, because as anything, right, as any tool, you have to know how to use it. You have to know when to stop and when to get off. Yeah, so I would just say, it's really important to have boundaries and set boundaries for yourself, just so you're not spending all that time, like Aubrey said, just spending all that time on social media where it's exhausting, and then it's just too much, right? You need to have a break. So
Yeah, I agree with all those. And one thing I'm getting reconnected to for myself, finding a hobby, is just getting outside. Like some of the kids say, go touch some grass, right? I have to go touch the grass. I have to get outside. I have to breathe fresh air. I have to see green things, see things, and just pay attention to butterflies, pay attention to birds and all that kind of stuff. But it really grounds me. It brings so much peace into my life. And I was thinking, as I think Dr. Dion had mentioned, parents understanding like what their children, or what the Gen Z person that they love are interacting with on social media, what tools they're using. A question I want to pose to Aubrey, and then I want Tawn to jump in, is why do you think it's hard for Gen Z to communicate their mental health struggles with their parents or other adults? And do you think there's a disconnect between the generations that causes that difficulty? And is there a difficulty, right, communicating what's happening to in your body to your parents or your caretakers? And how can we bridge that gap? And I want Aubrey to address it, and then for Tawn too, from your perspective.
Well, the first thing that came to mind when you asked the first question is, in the perspective of like brown and black communities, there's always the mom, I feel bad, or dad, I feel like this, or just we bring up an emotional mental concern, and usually it's, you better go wash some dishes, you better go pray it away, you better go do something else. You know what I mean? I know that it's not like that as much anymore, but it used to be, you have a roof over your head, you have clothes on your back, you have food on the table. What do you have to be sad for? What's the matter? And it's more than just what goes on in the home. It's what goes on now online and then at school. And it's just, you can't get away from it. And I think that's where the disconnect is. When we bring things towards our parents, sometimes they don't listen. And I say sometimes because parents are getting better at it, but it used to be a problem. And that's definitely where the disconnect is. And I feel like in order to bridge the gap between the two generations, it's a matter of, and what really would help me or helped me was if my mom said, I felt like this when I was your age. I was going through this. I was going through that. So I know how you feel. Instead of just invalidating their feelings, share experiences with them. And it might be a little embarrassing for them, but just really taking the time to show your child that you care and really acknowledge them. I feel like that would make a lot of difference. I'm not gonna lie. Like it would help a lot if you just said, I used to think about suicide too, or I used to think about harming myself too. I used to stay in the bathroom at lunch, and all of these things. My mom says, you are me. So I know how you feel. I know what you're going through. And she reminds me of that all the time. So it's incredibly validating when she tells me these things, and it makes me feel seen and heard. So in those ways, don't invalidate your kids. Kids, if you feel invalidated, find another space to express yourself. But yeah, those would bridge the gaps 100%.
Yeah, and I mean, Aubrey, I agree because as a parent, I have two children, and I've always tried to create that space for my kids where I'm a safe place. My husband's a safe place to come to. So I feel like we've indoctrinated that from the beginning, but there are so many parents who don't. They don't have that conversation. They don't have that safe space. So, and like you said, oh, you have a roof over your head, like be grateful, right? That's not the problem. The problem is all the external stimulus that is happening around them, the social media, right? The fear of missing out, FOMO, right? That's a thing I hear. you know, but if you can't find it in your parent, there are so many other resources where you can find that. You can get it from a teacher, you can get it from a counselor, right? There's resources for you if your parents aren't going to be those ones that you can speak to about it, right? There's other places, like you said, that you can go. And I think that's also really important. Maybe it's a grandparent, maybe it's an aunt or uncle, just someone else. It may not be your parent, but I also think that as we have these conversations, as our youth, the Gen X youth are becoming more, you guys are destigmatizing mental illness. Like it is happening. You guys have these conversations when in my generation, we did not have those conversations. So I feel like as you guys are having these conversations, now you're going to be the parents, right? Who the kids are going to be able to come to, and you're going to be able to have those. Hopefully, it'll be more open dialogue. I feel like it just wasn't like that when kids were growing up in my generation, and my other, like my mom's generation. I was definitely not. So I feel like as we grow, right, and the conversations are happening, those things are naturally gonna create safer spaces, hopefully for our kids.
Yeah, I think Gen Z, they're doing an amazing job being more open,
Yeah.
opening the conversation with us. And I'm glad, Ari, that your mom is forward thinking enough to make it relatable. Like, hey, I went through this. You are me, I am you. Like I went through this back then. That is amazing to hear. And for those who are listening, any questions that you have, you can just drop them into the chat and we're going to weave them into the conversation. We want this to be a conversation, not just the four of us. It's with you too. So if you're watching this, if you have a question, like, I really want to know this, drop it in the chat. If you don't want it to pop on the screen or anything, put anonymous on or AN on it. We'll see it. We won't put your name. But just let us know what questions you have. Yes, oh, go ahead, Dr. Young.
So I just want to add something. So just in my physician hat. So I know from my family growing up, we didn't talk about mental health. I know for sure I had two relatives that had mental health struggles, and we never talked about it. Like it was a direct, intentional decision that we didn't talk about it. We just ignored it.
Yeah.
But like in our generation, we're better, but you have to also realize, like for parents, if you don't know something, if it was uncomfortable growing up, it makes you feel anxious, and you're fearful of what could happen to your child. You're fearful of answers. So sometimes when we are fearful or we're anxious, we shut down. So your parents may want to talk but not have the words, not have the skills to start that conversation. So keep trying. Keep trying to engage them because it's probably not that they're not interested, is that that's what they learned to do, pray it away, and they're like telling you something they learned, or they don't know how to help you and that makes them feel anxious or fearful. So I would say keep trying. But also for physicians, I know people come to see us. It seems like a very busy, important appointment, but your health, like we said, mental health is health. So if you are struggling, tell your doctor, tell the nurse practitioner, tell whoever you meet with, because that is important. And it has to be a conversation that gets started with somebody you trust, and whether if that's not a parent figure or a friend, reach out to your physician. And now with portals, doesn't even have to, you don't have to wait until you have an appointment. Say, I'm struggling with X, Y, and Z. Can I have an appointment? What resources are out there so you can get an answer even if you're not physically in the office?
Yeah.
That's good to know. Can you tell us a little bit? You said the term portals. I want to make sure everyone
Oh,
understands portals,
sorry.
what they
So,
are. Yes.
depending on your health system or your physician, they'll have like electronic, like I'm at Mayo Clinic, so they have an app, and you can send a message to your physician through the app. Lots of even private practitioners, smaller offices will have a way for you to contact them and to get your medical records. Now, you should know, like, um, for and it depends on your state. If you get mental health treatment, it doesn't automatically mean that your parents will know about it because people want to create a safe space. So depending on where you are, there's a certain number of appointments you can have without permission, unless you're suicidal or you're homicidal, like unless there's like a threat. So don't be worried like, oh, if I reach out to my physician, they're going to tell my mom everything. It doesn't That's not necessarily true unless there's like a health threat, like a serious health threat. So use a portal like electronic communication, as again another tool to get help.
That's
That's
good to
great
know.
too. And then Dr. Hart, when you're saying about these, there's so many things that, like you said, that people can go, like apps, right, where they have mental health support. And I know there's quite a few um, that you can text to talk and like things like that too. So you can always Google, support mental health online, and I'm sure you could find different, depending on your state, to give you additional help that's free.
Yep, 988. You can
Yep,
chat, text, call.
absolutely. Yes.
Something else that you said that stuck out for me or popped out for me, Dr. Dion, is fearful of answers. And especially in the Black community, sometimes we're scared of what the answer may be. And so, for parents or caregivers who are listening right now, what are some questions that can kind of get us started? What could we ask to kind of open the door? Either asking directly to our child, or the child that we love, or to a physician. Like, I'm seeing something happen and I don't know what it is. Like, what are like some easy to remember questions or starter questions to start the conversation with our Gen Z member, but also to ask of their physician, just in case we see something and we're starting to see some signs of something, but we don't have the language for it. What can we ask?
So I'm gonna make sure Aubrey doesn't want to start because I don't want to cut her off. But so I would say, if one of the things that I think people get worried about, they worried about the perfect start, and then they never find like those perfect words, so they just don't start a conversation. So don't think that you have to have like some perfect words. Like, you can just say, just like if you came to your mom and said, "Oh, I have this stomach ache." And then she's going to ask you all these questions about, like, when was the last time you pooped? All these things, right? So you start the conversation, but it just started with, "I have a stomach ache. I don't feel good." So you can just say, like, I don't like, I get emotional, or I find myself crying. Like, you don't have to like try to come up with some perfect question to start a conversation. Just say how you're feeling. When it my One of my favorite movies for all people to talk about emotions is Inside Out. Like, I just love how they depict all the emotions and how they're all needed, right? So all the emotions, all the range is normal. So you can have days where you're just kind of a little irritable, and and you don't know how to explain it. It's the problem is when the days it become like stretches, and it
Mhm.
interferes with how you're functioning. So all of those conversations can just start with, "I don't know what's going on with me, but XYZ. Like, can you help me?" Or just sit and be with somebody. Sometimes that's also helpful. Not even having words, but just like knowing somebody is there, and seeing or touching somebody, like holding their hand, and just like you wait until you feel comfortable starting a dialogue. But Don't let perfection get in the way of a good start to a conversation.
For me, I would say, directed at parents, if there's some way that you connect with your kid, for example, you guys play baseball together, or you guys throw a football around, or you're baking, just whatever way you connect to say, hey, let's go do this. For example, if it was my mom, I'm the mom in this case, hey, let's go bake something, right? And as you're baking, you're measuring things out. Um, start asking, I would say, like, start asking little questions. How's school doing? How's your friends? How are you feeling about this? And, like, not be pushy, but just start small and then ease in more to, like, so I know you had trouble with your math test. How can we fix that? How can I support you more? How did you feel about that? You know? And another thing for parents, you have to go in with an open mind. I know the fear of answers, it's like, I don't want them to say that I'm a bad parent. I don't want them to say this. I don't want them to say that. You have to go in with an open mind. If you're trying to bridge that gap, and I wouldn't say like expand boundaries, but just kind of just get closer with your child, you have to go in with an open mind, non-judgmental, and you have to be ready to listen. That's the most important part. You have to listen. You have to listen, because your kid will start talking for so long and they'll ramble for so long, and then they'll just tell you the truth. I do it all the time. And they will talk for so long, and it's just gonna be word vomit. And they're gonna be, Mom, I feel this, Mom, I feel that. Oh my God, my life is over. Like, you just have to be willing to listen and give them that time and that space to be able to speak freely, non-judgmentally. If you want your kid to trust you, you have to go in with an open mind. Listen, validate their feelings, and be non-judgmental. That's the biggest thing.
I love that, Ton. I'd love for you to chime in on just on how you listened to Miles and how you continue to listen to Alexis and advocate for them.
Yeah, no, I mean, I think that is the most important thing, is also just being really aware, right? Some things are not right with my child, right? Like, there's signs, you see them, right? Don't ignore them. They're there. They're glaring probably at you, and you can't ignore them, can't pray them away, right? There's something more serious going on. And I think that's when you reach out to the NAMIs, right? The National Alliance of Mental Illness, to see maybe is this a mental health challenge? Is this something else going on? Like, some things that you may not even be able to like figure out or know, right? But sometimes there are resources for you to also to look into. But I would say, trust your instincts. Your instincts always know, right? When you know something's not right, as a parent, as a friend, trust those instincts. When you have those instincts, they're there. Those instincts are there for a reason. So just pay attention to how you feel about something, right? And then if you don't know the answer, then like, there's a lot of resources. There's a ton of resources, right? So just try to, sometimes you have to do a little research, but it could be just like, the National Alliance of Mental Illness or something like that. That's helpful. Like she said, Dr. Hart said 988. That's definitely another, possibility. Not that you would need that at this point, but just there are resources for you. So
That's good. One of the questions that we had spoken about a little bit earlier was, Gen Z is more open to, sharing about their journey, sharing about their boundaries.
mm-hmm.
And the question for Aubrey is, what impact do you think that Gen Z will have on the collective healing of mental illness, mental health challenges, given that you are so, more vocal, more open with how you're feeling? What do you think your impact will be on the generation? Who's next? Generation Alpha's next. What do you think the impact will be for them?
Well, definitely we're giving them, I wouldn't say big shoes to fill, because Gen Alpha, they're going to learn quickly. Just like Gen Z did, Gen Alpha is going to learn quickly. And I guess you could say that we're going to be the role models. I have a group of little cousins currently downstairs, and I babysit them all the time, almost every day. And they learn so fast. And showing them or modeling healthy coping skills, healthy communication, boundaries, modeling that for them, they're going to learn those things very quickly. And my little cousin, if I'm saying something to her, she'll be, I don't like that, Aubrey. And I'll be, okay, I respect it. We'll leave it alone. Like, and it's really about that too. But another thing for older generations, like, no offense, y'all might know a lot, but y'all don't know everything. And there's still more that you can learn from us. And I'm saying that with like all the respect in the world, because my mom is always learning things from me. My uncle, he's like in his 60s, almost 70s. He's learned a lot from me. It's just a matter of paying attention. It's not even just, oh, I can learn how to work a phone or how to work a computer. No, we are learning about ourselves with boundaries and mental health. We are breaking generational trauma. There are things that you guys can learn from us. There's so much. It's just a matter of paying attention and taking note and just saying, this kid knows what they're talking about. This kid knows their stuff, and just acknowledging that and considering that maybe I need to change my frame of thinking so that I can grow for myself and for the people around me. Yeah.
Well, all right then, Ms. Aubrey. Read us. Let's tell us about ourselves. Thank you.
I love it.
I love it too.
So wide, Deborah. I love it.
Right. I appreciate that. I'm going to pause for a moment. Again, for those who are watching and tuning in live, feel free to drop your questions in the comments. We will see them. We will address them. I'm trying to think where we should go next. We talked about the healing. I'm trying to think which way I want to go with this. Anything else? Anything that you all want to share that maybe that are not on our questions that we have that you think is critical for either a parent or a Gen Z member to know as a part of this conversation?
Well, I will give a shout out to Brandon Manor, who is a medical student that I worked with a couple of years ago, because the thing about Aubrey and like learning and listening. So I remember like going through like a checklist of all these things that I felt like we had to do for a project, and just like having like diarrhea in mouth, like a lot. And he just looked at me and said, that's a future me problem. I was like, what? Future me problem? What do you mean? We have all these things. And I looked at him and I realized he was saying, I can't deal with all of that at once. Like I have to like take care of these things in the present, and then I can deal with this other thing. And I thought that is very good. So like I quote him, I use that a lot. So like I think the idea of teaching people how to like speak up for themselves, like you said, these are my boundaries. These are the things that make me feel safe, make me feel heard. I think it is a lesson that the next generation will learn, but also that we should learn too, because respecting people's boundaries, learning how they love, learning what is meaningful and gives them value, learning even how they learn, like all those things, like we're paying attention to Gen Zers who are saying, you have to, like, this is what I need. And they're standing up for themselves. And I think that is something that all generations can learn. And I'm very excited that you're leading the way in those conversations. So thank you.
One thing that I didn't address that I wanted to. So you all see who's on the panel, right? We always have, if we're having a conversation about something or someone or some issue or some solution, the person who is there, who is centered, they're at the literal table, right? But there's, we have somebody that's not at the table right now, and this question came up, like, despite mental health being more widely discussed and embraced, toxic masculinity continues to make access to mental health a little harder for males. So what are some things parents and peers can begin to do to break down this kind of niche stigma when it comes to men, and particularly for our community, for Black men, feeling more comfortable and okay with sharing how they're really feeling? And even feel free to share some resources for Black men, Gen Zers, or those one generation, some millennial ones, to help them both destigmatize and, of course, decriminalize mental health and mental illness.
Well, it's Men's Mental Health Awareness Month. So there's lots of conversations that are happening. I think what's been helpful, particularly in the Black community, is there have been sports and celebrity and political figures who have said mental health is health, and this has been my struggle. And like, I don't want to say normalizing it because I think I hate that word, but I think opening up a conversation so people understand that it is completely appropriate and expected and necessary for people to take care of their mental health. So I think just I think like John Legend is one who comes to mind. Like people starting these conversations that are taking like the stigma out. But for men, like people think, oh, only women talk about their problems, or they put people in boxes. And I think people are starting to say like, no,
Mhm.
it is very important, and particularly because Black men experience so much direct and vicarious trauma that it is like necessary for you to have somebody that you can talk to. Um, I think everybody should have like a therapist, whether it's a formal one or that friend you call or a pastor. Like somebody should have somebody that they can decompress with. So I think for Black men especially, it is so important that you have someone that you can discuss all the things you're feeling, all the, macro, micro aggressions that you experience today, some place to put that and to process that and to like Aubrey was saying, find the coping skills that work for you. Find the hobby that works for you because it is so important that we make sure that we take care of Black men who, again, I feel very protective, are constantly under attack.
Mhm. Yeah. Yeah, and that's also something too with our foundation, Miles Foundation. We have a whole youth summit we've been doing for Black men in high school, right? So we do have them to have resources. So I just want to see more of that, right? More things that are in schools that are opportunities for Black men to be connected to other Black men who are either doing the work or have had experiences that have been like, really a lot of trauma but they've been able to overcome it. So those are a lot of conversations that we're having.
Yeah, I attended a Black men's mental health event last week, and I'm gonna link it in the resources for us too for the post event. But it's like 6 hours of conversations with men, just sharing openly, transparently. So you even see some of the data behind things that they're going through. It was an amazing space to sit in. And I know Omega Psi Phi fraternity, they have an initiative in this particular administration that's focused on Black men's mental health too. So look for those type of programs and programming that are programmatic offerings that are offered in your area and tap them in your life into it. Aubrey?
Um. Oh, not the dogs barking. I'm so sorry. But for my friend, and I'll use him as an example. EJ, if you're on here, hey gang. Um, but EJ, he one night, this was recently too. He was saying, "I'm so stressed. I'm this, I'm that. My job, I'm working such and such jobs. I'm not getting paid." Like he was really what we call he was ready about to crash out. He was going through it, and I stopped him, and I was like, "Okay, let's breathe, let's do this." And I stopped him. I said, "EJ, what species are you a part of?" And he said, "Human." I said, "That's what you are. You're a human. Realize that humans are not supposed to go through this amount of stress. If you need to, let something go." But I think the main message I was sent to him, and I was sent to all men, old, young, etc., is that you're human. It's not. I feel like it shouldn't be a discussion of, oh, women go through this or men go through that. We're all human, and we all have human emotions. It's like, yes, we function differently because women have estrogen, men have testosterone. There's differences, but we're all human, and we all go through similar experiences, and we all feel almost the same thing. And that's just something that I had to remind him. And for any male on here, you're human. You don't have to think I have to be manly because I'm a man. I have to do manly things because I'm a man. No, you have just the right of crying and breaking down as I do, as any other woman does, because you're human and it's okay to feel human emotions.
Yes.
I love that. I think it's I hate to bring up Inside Out again, but in the movie, like everyone has the same set of emotions.
Mhm.
They look different, they're dressed a little different based on their personality, but they're all useful and we have the same range of emotions. So I love that, Aubrey. So we are now at the top of the hour. I didn't see any questions. I hope I didn't miss anything. I know it kind of flew by. I want to first thank each of our panelists for being here, and I want you to share quickly how people can connect with you on your various outlets, like what they can look for, and we'll also link it in the after materials. So Aubrey?
You can reach me on Instagram if you guys choose to follow me. It's kind of a crazy username, not too crazy, but it's They Hate Aubrey, and I'll spell it out. It's THEYH8.AABRI, and I'll say it again, THEYH, the number 8, .AABRI. That's my Instagram.
Great. You can also follow us on the Miles Hall Foundation. We're on Facebook, Instagram, LinkedIn. So yeah. Thanks.
I am on, I think, like all the social media sites. I tended to be on Instagram the most at Little Doc D, LILDOCD. I hope we continue the conversation.
Thank you all. And I'm Tansy. You can find us at We Are 1M4 on all the platforms. And make sure you look at, share the right response directory to make sure the loved one in your life gets a mental health response to mental health emergencies. Thank you all again. Please share this live. The recording will be up on Facebook, YouTube, and LinkedIn before the end of the week. Make sure you share it with your loved ones and reference it again for yourselves. And also be sure to register so we can send you and email you our reference documents and links right afterwards. All right.
Great.
Hope you all have an amazing, amazing evening. See you later.
Bye.
Bye.